chaps. So,
Okay.
uh, and we are live. Hi, everybody. It's Jean Chatsky. Caught me just a little bit by surprise because I'm having a very nice conversation with my guest today, who many of you may recognize. This is the second time that John Whyte has been my guest on this regular Wednesday broadcast sponsored by the Alliance for Lifetime Income. He is the Chief Medical Officer of WebMD. He's also a popular physician and writer and healthcare policy expert. He's been in this field for 2 decades. And so today we are really going to have a conversation about what is going on in the world of healthcare, how all of that affects all of our wallets, and how we can stay safe, stay healthy, stay sane during these times. I want to welcome all of you who are joining us from both Facebook and LinkedIn. I hope that you'll participate in this conversation. Send us your questions. Let us know that you're here, and let us know what you're interested in hearing. So, John, let me just start with a question about what has changed since you were here the last time a couple of months ago. When we look at the arc of coronavirus, of COVID-19, where are we, and what are we looking toward in the future?
Jean, most of us thought when I spoke to you last that we would be in a situation now where we had some sense of normalcy, especially in terms of cases, deaths, hospitalizations. And unfortunately, as we had reopening maybe sooner than we should have, we've seen an increase in cases, and we continue to see cases increase at a rate that we would not really desire. And we also we're hoping that when it flattens out at a much lower rate. We don't want to be having, 10,000 cases a day. It's slowly getting below that, but, some days we're having 1,000 deaths. That's way too many. And a lot of people were hoping this summer, because we know heat and humidity is not the virus's friend, that would dramatically decrease. And we're not there. I did say to a friend the other day, remember in March when we said 15 days, it would only be 15 days to do these things and we'd be open by Easter or something. And we're not where we need to be. And we really need to, redouble our efforts to try to get to some sense of pre-COVID sanity.
I know that you've been having a number of conversations with leading physicians about what the prognosis is for the fall and that you're concerned. Can you tell us about that?
Sure. And I was chatting with the director of the CDC, Dr. Redfield, just about a week ago, and he talked about the fall could be a very dark fall, meaning lots of cases, deaths, because the challenge is the flu season is always, bad. And typically less than 50% of people get the flu shot. Last year it was 46%. Ideally, we want to be at 60, 70%. And the flu causes a lot of illnesses, especially in the elderly. But, it's tens of thousands of deaths, it's hundreds of thousands of hospitalizations. And here, if we have COVID going on, which they can look similarly in terms of presentation, you're going to superimpose two serious respiratory illnesses, the health system may not be able to sustain it. That's the real concern. So then we go back to canceling surgeries. We, cancel elective procedures. We have the push for PPE, and hopefully we'll be in a better situation today than we were in March and April. So that's the real concern. And the focus has been people now getting ready, hopefully getting the flu shot. But we are, somewhat better in terms of our treatment options as well.
Well, let's actually elaborate on both of those things. So the flu shot in particular, I've started to see places saying, come get your flu shot. But I've also heard that maybe you shouldn't get your flu shot just yet, because you can only get it once, right?
That's right. That's right. And I still see patients, and I will tell you, it's required for us to get the flu vaccine as a physician or healthcare worker, and they haven't given them out yet, where I practice. So we do want people to get the flu shot, but the effectiveness of the flu vaccine decreases over time. And really, flu continues to, April, sometimes even early May, but definitely April. So if you get it too early, say right now, there's a chance that the effectiveness of the vaccine may wane over time, and then you're at risk in March and April. So what most experts are saying, and there's some disagreement, but the majority of experts say it's really late September, October. I mean, I can't even get my children to get the flu shot yet. I have to bring them back, which I'm not so happy about. It would have been nice if during school physicals we could have had that all done, but it
Yeah.
wasn't available in August because it's too soon for most people. So, if now's the only time that you could ever get it, then I'd say go ahead. But most of us have some flexibility. I'd wait till mid-September, late September, and get it then. And there's going to be plenty of flu vaccine. But I
I
will
was
tell you,
going to ask, do we have
yeah.
to worry that we're going to run short?
No, they anticipated that. So they actually ordered much more flu vaccine. And the CDC actually has ordered over 500,000 doses that will be available for people that don't have insurance or can't pay, to make sure that especially those vulnerable populations, those marginalized populations that may not have access to the flu vaccine because they can't afford it and they don't have insurance, will be able to get it. And that's terrific because they're often at greater risk for COVID. And then nobody wants to be confused over, do you have flu? Do you have, COVID? So if you've had resistance in the past, I would encourage you to get the flu vaccine. And the flu vaccine does not give you the flu. I know some people are probably saying, "Oh, but it does." It doesn't. It doesn't.
Okay. And the flu vaccine is not going to make you more susceptible to COVID either.
Not at all. Nope. If anything, it's hopefully going to, make sure you don't get two conditions. Because remember, you could get the flu and you could get COVID. They're two different respiratory viruses, and you definitely don't want that happening. You definitely don't want that happening if you're elderly or you have other health conditions.
How is our healthcare system faring now? Are we starting to see people going back to the doctor, back to the dentist, back for the elective procedures that they put off?
Hospitals and health systems are losing, many of them, hundreds of millions of dollars a month. And that's mostly been because people aren't coming in for procedures. People aren't coming in that much. We're starting to see that reopen where people are starting to schedule their elective procedures, hip replacement, cataract removal, other issues, as well as starting to go back, to their primary care physicians, get their screenings, colonoscopies, mammographies. They were down 80, 90%. And the
Wow.
concern is that people will never come back for those. So, I'll tell you, it's still in a critical condition because, we haven't been able to surge back up to where we were, pre-COVID. People have lost insurance, so they're not getting care. It's really a challenge, especially for those systems that serve, in those communities that disproportionately impact, people of color and minorities. They're the hardest hit in terms of financially being able to survive. So we're starting to see some improvements, to be honest, from where we were, in April and May. Telehealth, telemedicine has helped, dramatically. But as we talked about once, that alone is not going to sustain the healthcare system. At the end of the day, it's procedures, it's, stents, it's revascularization that, bringing the dollars to help support the system. So we're going
Yeah.
to see that over time. And we need to help viewers realize it's safe to go back to the doctor. It's safe to go back to the hospital. I could argue that it's safer to go to see your doctor than it is to go to the grocery store because everyone's being, tested. Everyone's, being screened. And there's really a desire to not have any, social gatherings where, typically we wait in the doctor's office for 30, 40 an hour
Right.
until we're seen with a bunch of other people. That's not happening right now.
No, I mean, I went to the dentist recently.
Hmm.
I stayed in my car
Yep.
until the dentist was ready for me. At
Hmm.
that point, they texted me and they said, okay, you
Hmm.
can come in now. And they had, they took my temperature. I mean,
Good. Yeah.
they're really being much safer. But this fact, and let me just say hi to everybody who's
Mhm.
joining us, to Shari and Carmelo and Mark and Sherry and Shalea. I hope I pronounced that right. Thank you guys for being part of this. If you've got questions, please, we are here to answer them, about your questions about your health and your health care and health insurance questions going forward. When we look at people putting off these
Mhm.
procedures, when we look at not going to the dentist, not going for a physical, not having a mammogram, not having a colonoscopy, or just not going to the doctor when you're not feeling well, I think of this like a gutter problem. Like,
Mhm.
if you don't clean your gutters, then eventually you get a huge, big repair bill on your
Mhm.
house. And that is what all of this preventative care is supposed to stave off, that bigger health bill. So
That's exactly right.
what do you want to tell people right now about the fact that they really need to actually get these procedures and these well visits done?
A couple months ago, it made sense. Stay home. We weren't really sure what was happening with transmission of the virus, still figuring out all our processes. That's really all settled now. Delaying care for too long can ultimately result in a very bad situation, as you described. The number of heart attacks that presented to the emergency room, the number of strokes were way down. People obviously were still having those. And
Yeah.
what's the concern is that people are going to present much later with much more serious conditions. And the other issue can be depending upon what's happening with the economy. I know people are anxious and worried about finances, but if you lose your job, you typically lose your health insurance, and then what do you do? So if you've been waiting, thinking, well, I'll do it next year, I just don't feel like it's the right time. It is the right time, and you want to listen to your body, and you don't want to delay care, certainly if you're having symptoms, and you want to make sure you refill all those medicines. And doing a 90-day supply should always be the case. So you don't have to go, back in, or you don't have to wait for the mail to deliver it. So I know it's hard right now for many people to focus on their health because there's often a cost to that, even if it's, a deductible. And money is tight right now for a lot of people, but it's really investing in your health because if you don't have your health, you really don't have anything.
Yeah.
And we don't want people to have that horrible situation where then they end up having a heart attack, they don't have insurance, and they're hit with a very high hospital bill because we know that medical bills is a top reason, for personal bankruptcy.
It's the number one cause of personal bankruptcy, typically in a typical
Mhm.
year in and year out, for as long as I've been covering
Mhm.
personal finance. We've got some questions here, and they're
Sure.
good ones. I want to get to some of those. Malik or Malak, I hope I'm saying that right, writes, I heard there would be reimbursements from the insurance companies because of underutilization. I heard the same thing, by the way.
Mhm.
How do we go about getting that rebate or credit?
What I've heard from it is that some of the big insurers have given some premium reduction of 10%. Some of the car insurance have done that as well.
Mhm.
So it depends. Some of it is reduction in your premium and not money back. Remember, it also depends how your insurance is set up. A lot of companies are self-insured, so even if you have a United or an Anthem, I mean, as you know, Gene, they're just processing the claims. They're not determining everything because your employer may be self-insured. But you definitely should ask and inquire. You can call on the back of your insurance card, but I will tell you, many of them aren't giving um, rebates directly in cash to consumers. But it's a great point because many of them have done very well in terms of because they haven't been providing services. Their concern is what's going to happen next year. But
Yeah.
we should bring that up, just as we've seen with car payments and some others.
Yeah, auto and homeowners insurance
Mhm.
too. And if you haven't gotten those reimbursements or rebates, or a break on price from your auto or your homeowner's insurer, and you're spending a lot more time at home, you should absolutely call and ask for it. There is savings to be had. Stephen points out, and this is Steve points out, that the CDC recommends 10,000 steps a day to stay healthy. For him, that's a 3-mile walk in the morning and a 2-mile jog in the evening. That's a lot of steps. Absolutely. But I think he has a very valid point. When we talk about the intersection of health and finances, staying healthy by eating well, by getting your steps, by trying to keep your stress low is one way to make sure that you've got more money for the long term.
That's right. And I don't know if he was looking at some of my Instagram posts where I posted that the other day. Lately, I've been having like 2,000 steps. You're having 10,000, you're 2,000 because I'm on Zooms all day. But you're right. And, part of it is just getting moving, just starting to resume some of those healthy behaviors. We've talked about the COVID-15 where people are gaining, 15 pounds. And, I've gained some weight. I'm eating later at night because I'm doing emails all day. I'm not walking around because you're not walking your car, not walking to the metro or the subway. So it's a great point. And that's going to help with anxiety as well. No one ever regrets after they go work out, right? You kind of don't want to do it. You don't want to get, you have patients say, I don't want to get sweaty. That's the whole point. But now, we really don't have the issue of we have to travel. We don't have to commute. We need to start to try to work it in. And if you can't do 10,000 steps a day, if you can do 5,000 and you're at 2,000 like me, that's progress, and then have that as a goal. But having physical activity, healthy eating, that's really important.
Yeah. Sultana asks, what about our mental health issues during these times? And Shayala points out it's definitely been more accessible virtually. I mean, that's one of the areas where telehealth can sometimes be very effective.
Right. And telepsychiatry. And there's been a focus there because there aren't always a lot of, providers in certain communities to provide the services for folks. And, you've mentioned I've been interviewing a lot of people, and we've been talking about there's a mental health pandemic as well as an infectious disease pandemic. And a bunch of different celebrities, including Kenneth Cole, have talked about this campaign. How are you doing really? And just last week, I spoke with the American Federation for Suicide Prevention. Suicide pre-COVID was on the wrong curve. It was going up. Now we're seeing, sadly, an increase during the pandemic. The feelings of loneliness, the feelings of despair, the feelings of PTSD. So it's really an issue that, we have to address. We have to be able to look out, for our friends and our loved ones and our family, to appreciate that for many people, this is a really hard time. And how do we help them cope? And the first thing is really, acknowledging that one isn't doing so well, and that's okay. There's a lot of people that aren't doing well, but, mental health is equally as important as we talked about, our physical health and our emotional health as well.
And I think, understanding that it is normal to not feel normal right now, and that it is okay there's such a stigma against getting help when it comes to your mental health. Absolutely. And there absolutely shouldn't be. It's an illness like everything else. Sherry points out that her insurance is waiving copays from May until December. So that is one way the insurance companies are saving people money. Let's talk about health insurance a little bit, because this is the time of year when we start looking toward open enrollment period that rolls around in the fall. For people who have less money to spend than they did before, for insurance plans that are changing in the midst of all of this, I told you that mine is. How should we approach this open enrollment season?
Well, first, you never want to forego insurance. I know some people may be thinking, when you look at those, dollars in terms of your paycheck, for families, it can be several $100s, and that can, really be something that you may need right now. But you don't want to jeopardize your financial security and your health by not re-enrolling or not choosing a plan. So you have to have insurance. The big issue, depending upon what's available, is if you're not in a high deductible plan, do you move to high deductible plan?
Can you
because
just
then,
can you
so
just pause and explain it?
yeah, so high deductible would mean, you know what, I have to reach a threshold of $5,000, $7,000 before my insurance kicks in. It still may pay for certain things that are mandated by law. Certain preventive services won't fall under that, but I have to put out the first $5,000 before my insurance will kick in. Although I'm still paying my insurance premiums, but they're going to be lower. Um, and the way that you're doing there is you're really gauging. You're not exactly playing, roulette, but you're thinking, okay, I don't have a lot of health conditions. I don't, I'm not going to need any procedures, although no one ever knows if they need an emergency procedure. So it can be a little bit of a gamble. You'll save money in the short term and hopefully overall, but some people may move to that high deductible plan, and some employers are only moving to a high deductible plan. And you'll have to bear that first. It's usually several $1,000s. So you'll need to consider that versus the traditional plan is, you may have to pay 20% of everything depending upon, what type of plan you have. So you can have some savings by switching your plan. Those savings may be immediate, meaning each paycheck, but there could be a risk that later on you have to pay much more depending upon, your overall health. If you're pretty healthy, you might want to go with a high deductible. If you have children, it's always, a challenge. Kids, have things that come up. But you can also think about, as we talked about, what do you combine that high deductible plan with in terms of a health savings account, a flexible spending account. And this all seems to be, so painful to figure out, but it's worth your time to think about it. And it's really worth, your economic success as well as your overall health.
Yeah, I mean, if you go with a high deductible health plan that gives you the ability to open a health savings account, and they don't all do that, so you have to be
Mm-hmm.
sure that you are in a qualifying plan. But essentially, that allows you to put a bucket of tax-free money into the health savings account and then pay for your healthcare out of that account, which essentially shaves 25% off of the cost of any healthcare expense, pretty much.
That's right. So if your employer allows that, that is something to consider. And that is different than the flexible spending account. And it can be confusing because there's only one letter difference,
Yeah.
but legally they're very different in
Yeah,
terms
the
of what
flexible
you can
spending.
and cannot do, whether or not it's technically your money, whether it rolls over. So you don't want to confuse them either.
Right, absolutely. Although, just a pointer for people who do have a flexible spending account right now, there's some leeway under the CARES Act for employers to allow you to stretch your ability to use that money a little bit longer or to stop making contributions if you don't think you're going to use it. So, just bottom line, if you've got one of these and you want to make a change, talk to your employer and see if they're ready to tee that ability up for you, because it does go employer by employer. Let's talk about people who are a few years, maybe a half decade away from retirement.
Mhm.
And the world of work is looking incredibly precarious.
Mhm.
How do you protect your ability to stay healthy and fund your retirement at the same time?
Yeah. I have physician friends who are saying, you know what, this is just too hard now, and I don't feel like dealing with it. And I'm gonna, they might have been thinking they'd stay open for 5 more years, and now some of them are thinking, I'm just gonna close up shop now. So, to your point, you really have to have a good financial assessment, and many of us don't do that. You need to look at, what you have saved. You need to look at your plans. And the challenge right now is, if you're thinking interest rates, it doesn't even make sense to have something in checking and savings because most of them are so low. But just as I'd want you to be up to date on your screenings and everything else, you really have to first see, where am I financially? And people don't like to do this, and you probably tell people to do this. I don't do this. I should. What are your monthly expenses? And be realistic. And in some ways, just like calorie counting, you have to write everything down for a couple of weeks to get a good assessment. You really have to write everything down. And then you have to, be realistic about anticipating. So, Gene, I think part of it is, people have to get their financial house in order and really have a good assessment. Like that's the first thing. And then in many ways, work means different things for different people. Some feel, professional success, and that's part of their identity, and they enjoy doing it, and they don't want to be in the house, all day. And others are like, you know what? As soon as I can retire, I will. And what's interesting here is I was having this conversation the other day. A lot of people are like, I want to retire and travel. Well, I don't know if you retire right now, you're going to be able to travel. So
Right.
maybe I'll stay a little longer. But a lot of it also depends what's going to happen, with insurance. If you retire, is it going to be part of an employer agreement that they'll cover your insurance for a period of time before you become Medicare eligible? Let's not forget about those aspects as well. And then how do you have some income that, is pretty predictable and regular? Like that's the challenge as well. And you know that better than I. I don't want folks to just become so frustrated and be like, it's not worth it, or think I'm too old, to work. Sadly, a lot of us have to. We just have bills, we have, college expenses. Who knows what's going to happen with that in the future if it's all virtual? But you really have to have that financial checkup.
I have seen research in the past that says that working actually keeps people healthier and happier, and that a
If
big
you like it,
yeah,
if you
but
feel like you have purpose, yeah,
but that a big part of that is loneliness.
yeah,
My a book that I wrote a couple of years ago was with a doctor named Mike Roizen, um,
sure, from
from the
Cleveland Clinic.
Cleveland Clinic, and we wrote a book called Age Proof. And
Mhm.
Mike likes to say that loneliness can be as bad as smoking a pack of cigarettes a day.
Yeah.
I
Hmm.
mean, that every time I've heard that come out of his mouth multiple times, and it always just stops me because I think we
Yeah,
don't gauge that. And as we think about what we're going through now, that's a big part of it.
sure. I think some of it is, if you work, if you're going to retire, do you have hobbies? Do you have friends? Are there, things of interest? You don't want to just in some ways retire and then you don't have any of those other elements or any of those other interests. And then you're right, you become lonely. Mike is going to be like a Supreme Court justice, work
Yes, one of
to
these
the
days.
very end. Uh, and that's good because that's the sense of purpose. But what is it for others? And you have to balance it. You have to be realistic about your expenses and your financial viability to retire early. Because remember, people forget. Hopefully, you're going to live if you're 55, 60. Say you're 60. Hopefully, you're going to live another 20 years, another 25 years. And how are you going to pay for that during that time period?
Yeah, well, and that's the bread and butter of what we talk about on this show all the time, that you do need to have that financial checkup. You need to know where you stand. You need to know how long those assets will last you, and you need a plan for taking all
Mhm.
this money that you've amassed during your working life and turning it into a stream of income that will last hopefully for
Sure.
as long as you
Yeah.
do. John, first of all, thank you for coming to the show for
Sure.
a second time. I so appreciate
Mhm.
it. But also, where can we find more of the great work that you do every day?
Sure. Well, you can come to webmd.com. We have a lot on our homepage. You can follow me on Twitter and Instagram. It's at Dr. John Whyte. Always happy to engage with folks, or LinkedIn. I accept basically everyone's a friend request, etc. And I want to thank you for all you're doing in terms of really trying to help with financial literacy, helping people during these very, stressful times in terms of, what to do.
Well, thank you. Thank you so much. And for anybody who's looking for more information and more resources, I hope you'll check us out at protectedincome.org. We will see you back here next week. Thanks so much, guys. Bye, John.
Thank you.